All right, as a medical trainee, you are going to face countless clinical puzzles. I mean, that's the job, right? But there's one you are absolutely guaranteed to see: the patient with the mysterious liver injury. Today, we're going to crack that case. And this isn't some textbook hypothetical. This is a practical guide for a situation you will find yourself in.
So, picture this. You're on rounds. Your patient's liver enzymes are sky high. Their skin's starting to look yellow, and you've run every test in the book. Viruses? Nope. Autoimmune? Negative. You even did the imaging, and it's totally clear. You feel like you've hit a wall. But the missing piece of this puzzle, it isn't in another lab test. It's in a question you haven't asked.
So what's that missing piece? Well, 9 times out of 10, it's hidden in the world of herbal and dietary supplements, or what we call HDS. This is a huge blind spot in modern medicine, and honestly, it's just getting bigger every single year.
To get a sense of the scale here, just look at this number: $40 billion. That's how big the U.S. supplement market was back in 2019. This isn't some niche hobby for a few people. It's a massive, massive industry, and you can bet a lot of your patients are a part of it.
And here's the clinical fallout from that huge market. The Drug-Induced Liver Injury Network, or DILIN, found that in just about a decade, supplements went from causing about 7% of all drug-induced liver injuries to a shocking 20%. It nearly tripled. This isn't just a trend, it's a real and growing public health problem.
So, this is the core of the issue. Why is this such a blind spot? Well, because most patients don't even tell us they're taking this stuff. Seriously, fewer than 40%. In their mind, natural equals harmless. So they just don't think of a supplement as a drug worth mentioning. And that disconnect is exactly what makes diagnosing herb-induced liver injury, or HILI, so incredibly tough.
Okay, so how can these supposedly harmless products cause so much damage? The answer, my friends, lies in the regulatory system. Or maybe I should say, the lack of one.
This slide basically says it all. Because of a law passed back in 1994, drugs and supplements live in 2 totally different universes. A real drug has to be proven safe and effective before it ever hits the market. But a supplement? It's just assumed to be safe. The FDA can only step in and prove it's unsafe after it's already on the shelf and in your patient's home.
You've all seen this disclaimer, right? It's legally required on any supplement that makes a claim. But this isn't just legal jargon. It's basically a confession. It's the company saying, right on the bottle, hey, just so you know, the FDA has not checked any of this out.
And the result of this hands-off approach? It's the Wild West. You find supplements that are secretly spiked with actual prescription drugs like steroids or Viagra. You find them contaminated with heavy metals. Sometimes they don't even contain the right herb. And maybe worst of all, the ingredients can change completely from one bottle to the next. So you're not just hunting for one toxic thing, you're chasing a moving target.
Okay, so we get it. It's a huge problem. Now for the important part. What do you do about it? Let's build your framework for actually solving this clinical mystery. How do you crack the HLI case?
Your whole investigation really boils down to these 4 key steps. Number 1, and this is the big one, you have to ask the question. You have to take a specific and totally non-judgmental history about supplements. 2, you establish temporality. Did the liver problems start after they started the supplement? 3, you do your due diligence, rule out all the other common culprits. And finally, number 4, the money shot. You see if they get better after stopping the suspected product. We call that a D-challenge.
So as you're taking that history, you need to be listening for these red flags. I mean, on their own, things like nausea or fatigue are super vague, right? But when you see them together, especially with jaundice or that really intense itching, your HILI suspicion should go way up. That constellation of symptoms is your trigger to start asking about supplements.
Now, you might come across scoring systems in your reading, like something called the RUCAM scale. It's a tool used in research for drug-induced liver injury. But here's the thing. It was never validated for supplements for all those reasons we just talked about, the contamination, the variability. So in the real world, on the hospital floor, this diagnosis doesn't come from a scorecard. It comes from your solid clinical investigation and good old-fashioned judgment. So you've done your detective work, you've got a prime suspect in your sights. What's the last phase? How do you officially close this case?
It's beautifully simple. The single most important thing you can do is have the patient stop taking the supplement. Just stop it. In the huge majority of cases that haven't already gone into full-blown liver failure, that is the only treatment they'll need.
But your job isn't quite done yet.
Every single time you suspect a case of HOII, you need to report it to the FDA's MedWatch program. This is so critical. Remember how we said the FDA relies on data after a product is on the market? Well, your report is that data. It's the evidence they need to spot a dangerous product and protect the next person from getting hurt.
To finish up, let's take a quick look at a few of the most common offenders you should definitely have on your radar. Think of this as your high-yield, most wanted list, good for boards and for your rotations.
Okay, here are some of the usual suspects. You got anabolic steroids, often hidden in bodybuilding products, which can cause this really profound jaundice. Green tea extract, which is in tons of weight loss stuff, can cause direct damage to the liver cells, a hepatocellular injury. Turmeric has been linked to both that pattern and a cholestatic one, where bile flow gets blocked up. Kava, used for anxiety, can cause actual liver cell death, which is necrosis. And finally, these things called paralysine alkaloids, found in teas like comfrey, they cause a really unique vascular injury. Recognizing these patterns is half the battle.
So let's end right back where we started. The most powerful, most critical diagnostic test for herb-induced liver injury isn't a blood test or an MRI. It costs absolutely nothing. It's a conversation. It's just a question. So the next time you're facing that patient with unexplained hepatitis, please remember to ask, what's really in your medicine cabinet?